Here, it's Sedona Urgent Care with Dr. Allen. We have a great person that wants to talk to you today. Her name is Beverly, and she's from Mississippi. Beverly's going to talk to you about a couple of things. She's going to talk to you clearly about her experiences that she had receiving chemotherapy, which is what she's doing now. And she's going to also talk about her experiences that she had with the vaccine. So, let's start. So this is Beverly. Out of respect for Beverly, she is a breast cancer survivor. Well, breast cancer, she currently has breast cancer. We're going to put our mask on. She had 2 vaccines, Moderna, is the vaccine that she had. Again, she's going to give you her side of what she felt and the things that she is currently going through receiving chemotherapy at this time. Okay.
Hello.
Good job. Beverly, what part of Mississippi are you from?
I'm from Gulfport, Mississippi, right down on the coast. I live about 6 blocks from the beach, the sun, and the sand, white sand.
For those guys that know me as well, I'm from Cleveland, Mississippi. So it's a beautiful thing to share this moment with Beverly. Beverly, can you take your phone out? I wanted to just show where you had your first Moderna vaccine, the date that you had it, and I'm going to ask you to kind of tell us your experience that you received from the initial vaccine.
Sure. While I'm looking for it, the first vaccine I had on March 5th, and there we go.
I'm going to ask that you zoom in. She had Moderna on 3/5/21, Miss Beverly.
And the second vaccine I had on the 2nd of April.
Beverly has other underlying immune deficiency that I would let her feel free if she wants to talk about. But the biggest concern is these are some things to expect if you have an immune deficiency. Now keep in mind, Beverly does currently have breast cancer, of which she's going to talk about chemotherapy. Let us know about your experience from your first vaccine.
Well, the first vaccine, I really didn't have any problems. My arm was sore, sort of like what you would experience with a tetanus shot. If anybody's had a tetanus shot in the last 10 years, you know your arm gets really, really sore. I iced it, and that was the end of my arm hurting. It hurt for a couple of days, and that was it with the first vaccine.
Good. So remember, we're not supporting or promoting, or we're not anti-vax. Our goal is just to give you some experiences that others are having with the vaccine. Her first experience with the vaccine as a person with breast cancer who's currently getting chemotherapy was the normal reaction that anyone would have gotten who took the vaccine. How was your second vaccine?
My second vaccine was a lot rougher. I had had chemo the day before. So that experience, I think the chemo on top, as the weekend wore on, by Saturday, I was just, for lack of a better phrase, under the bed. There was nothing else I could do. I couldn't lift my head. I was achy, feeling my body was hurting everywhere. Tylenol didn't seem to help. It was a rougher experience with the second one. But I don't want to...
How long did it last?
Probably 4 days, but that, again, my chemo, the type of chemotherapy that I have is cumulative. So that was about my 4th or 5th treatment. And what I mean by cumulative is the more the chemo gets in the system, the more chemo you have, the more side effects and symptoms you're going to have. So you're not just, it's not like you're one and done each time. It gets worse, it gets worse, it gets worse, it gets worse. So that's what I was experiencing. That was about my 5th treatment. And
so what you went through from the second vaccine was kind of what you expected to go through, or? or was it a bit more difficult than what you're
I think it was more difficult. I didn't know what to expect. They say flu-like symptoms, cold-like symptoms. I don't have colds and flu. I haven't had a cold in over 30 years. I haven't had flu that I ever can recall. So I didn't know what to expect.
The rationale, again, from the second vaccine, if you have an underlying immune deficiency, remember, you don't get this data from the television station or from the news. This is an actual person letting you know, if you have an underlying immune deficiency, she's clearly letting you know that when she got this second vaccine, a little more difficult than the first vaccine, had her down for about 4 or 5 days, and she recovered, and at this particular time, she is negative from her PCR testing for COVID, and I think you've had a couple of
Yes.
test follow-up,
Yes.
and those tests for COVID have been negative. So now I'm going to ask you, Beverly, if you'll be so kind to tell the audience about your experience with breast cancer.
Okay. I had in 2019 a mammogram, which it was negative. But ever since I was a young adult, I've had difficulties. I'm trying to think of the age, but I've had difficulties with breast tissue. My doctors have said that I have dense breast tissue, so they feel more thick, more granular, and so I've had diagnostic mammograms more than just the screening mammograms, just because it always looks like there's a shadow of something there. I had a needle biopsy when I was in my 30s that was just a sack of fluid. So 2019 I had my breast exam, and it was negative. 2020, of course, no one had anything done. And then in November of 2020, my doctor sent me again, and they said, October, they said, oh, and so I said, oh, they're just dense again and stuff like that. Well, when they called me back, like the day after I had the diagnostic mammogram, I knew something. It was just the fact that the call came so quickly. And so the first person I saw after that was the surgeon. And he said that my tumor was 1.7 centimeters, and he said about the size of the head of your thumbnail, which is about that. But then he said, well, for me to do this, to do surgery and to get clear margins, I'm going to have to cut out about this much breast tissue. So I'll be quite honest, you may not know, but I'm a size B cup. And if you take that much breast tissue, that means I'm going to be disfigured. And whereas I was living in Mississippi and I could have gone to New Orleans to have the surgery and everything, I didn't have the support system that I needed in Mississippi. I'm originally Southern California girl, went to Whittier College, go Poets, went to grad school at Cal State LA, but chemo, who was going to help me when I got sick, who was going to be there for my emotional support. So my sister and her 3 daughters and her husband live here, as well as my ex. So I came back here for treatment. Now, because I moved permanently, I was able to change insurance companies and go with something that was going to meet my needs, whereas what I had in Mississippi was not meeting my needs for my testing and everything else. Well,
I'm going to interrupt real quick. For the Mississippi audience, I do want to ask one question to Ms. Beverly. What was the insurance in Mississippi, and why wasn't it meeting the needs?
I had Humana. I had been well most of 2018, even though I have all these underlying autoimmune diseases. I had been pretty well. I had been managing my health care. I was walking up to 5 miles a day, 3 to 5 days a week. I had gone from when I moved to Mississippi being on 13 medicines a day down to 4 medicines a day. So,
and we're going to emphasize, were those chemotherapy medications?
No, these were medicines.
The regular medications?
Yes.
So you were on 13 different medications a day?
Yes.
Okay, for multiple issues?
Yes. So, mostly dealing with fibromyalgia, arthritis, high blood pressure, cholesteremia, that kind of stuff.
And for my Mississippi audience, that's what we mostly suffer from, all that good food that we eat.
Yes.
Please go forward.
Okay,
Mm-hmm.
so anyway, I knew that I was not going to receive treatment there because I didn't have the family there to take care of me, to help me get to and from treatment and things like that. So I moved out here with my sister and changed insurances. Well, I knew that I wanted to go to City of Hope. My dad had received treatment at City of Hope, and he had expired while he was on treatment at City of Hope from lung cancer.
And we want to emphasize, can you tell us what's special about the City of Hope?
City of Hope is a nationally certified cancer institute. I mean, it's like if you got cancer, you want to go where they do nothing but cancer and diabetes. And I don't have diabetes, but I do have cancer, and I wanted to go where I knew. I lived in Pasadena before I left here. I applied for a job at City of Hope. I was well aware of what City of Hope does and is capable of doing. It's sort of like MD Anderson in Texas. It's like, John Hopkins and all the places that specialize in certain types of medicine. That's what City of Hope does.
And so you got into the City of Hope.
Yes, when I came out here, I did my first visit with a surgeon because I knew they had put a marking clip around the tumor, and I knew that I would have to have that taken out. And so I talked to the doctors, the surgeon, and she explained the surgical procedure. She explained what would happen if I had radiation, what my chances of surviving. She also explained if I had chemotherapy, what my chances of survival. Black women tend to die from breast cancer, not with breast cancer. I want to be a woman who dies with breast cancer, not from it. Meaning that it's still in my body, it's always going to be in my body from here on out, but it's not going to cause any problems, if you understand what I mean.
In remission?
In remission, totally gone, whatever. I just want everybody to know that, I had cancer, and so now I'm over it, and that's it. But I don't want stuff still growing. I don't want stuff attacking my liver. I don't want stuff in my stomach or colon. That cancer is no longer a part of my body. And so I felt that City of Hope would give me my best options.
Now, do you still have breast cancer?
Yes, I still have treatments to go through. I'm almost finished with my first round of chemotherapy, and I have a second one according to the doctors. Not according to me, but according to the doctors. And then I also have radiation. I have 20 cycles of radiation that I need to have as well.
So 2 things I would like for you to say to the audience. One, I would like for you to tell the women who are watching what should they look for, how to be strong if this happened to them, and anything positive from that standpoint.
Okay, well, the first thing is, the best thing to do is to always do your self-checks and to do your mammograms. I was the director of a cancer agency, and we taught young girls many, many years ago how to do self-breast exams. And as a result of that, some girls went home and taught their mothers how to do that, and their mothers found lumps. I've gone through so many things with women and breast cancer, but I think it prepared me, and it's preparing me for what I'm doing now. Not only was I director of a cancer agency, I worked for hospice as a hospice social worker. So as people were at the end stage of their life, I also knew, I'm not afraid of death. I want a quality of life. And that's one of the reasons why I'm doing this and why I took the COVID shot, is because I want a quality of life. I want to be able to travel. I want to be able to go places. I don't want to be afraid of telling my nephew who has a new baby being born August 2nd, I can't come see you because I might give you something. I want to be able to live life. I want to be able to travel out of the country and do all those things. And I don't believe that we can do those things if we don't take care of ourselves. So that's the first thing.
Nice.
The second thing is
encouraging. How would you encourage the women?
I would encourage women to find their village, whoever that village is. It's amazing the people who have stepped up to the plate for me and who have really come through. My daughter, I'll be very transparent. My daughter and I stopped speaking a few years ago, and she was the first person I called after I got my diagnosis. She asked all the appropriate questions. We hadn't talked in 3 years. 3 years. And we were very close. She's my only girl. And my son's been had been shouldering all of my health issues by himself. But my daughter stepped up to the plate. She's come through. And I honestly say that if for no other reason than the fact that I have my daughter back, I'm okay with this breast cancer. I really am. I am totally okay.
You can't make me cry. You can't make me cry. You can't make me cry. We both gotta be strong. Mississippi warriors. We get beat up, but we come back.
So
the support team was the next thing I was gonna say. For the people that's family members, what can we tell the family members to do to help anyone in this situation?
Okay, so when this doctor told me he was going to take out the size of a golf ball of my tiny little breast, I was like, well, look, if I'm going to be reconstructed, I'm going to LA, because nobody constructs bodies better than LA. Miami might be second, but LA is number one. So I decided that I was okay with having a radical bilateral mastectomy and having total reconstruction. I was okay with that. My family didn't agree with me on that. My sister, who is also a breast cancer survivor, whose whole thing was to preserve her breast, told me I was being too aggressive. Well, your course of treatment was your course of treatment. My course of treatment is my course of treatment. So what we have to do is we have to understand, families have to understand, tell me what you want me to do. Like, I've had some challenges with my health insurance, and I've told my children, I need you to do this, I need you to do that. When I'm sitting at the dining room table and my other sister is there with me and my head is on the table and I'm crying, and she says, what do you want me to do? And I just say, change the sheets on my bed. And so it changes, and what the family has to do is understand that just do what they ask. Don't try to do anything extra, because, and it's going to change from day to day. It's really going to change from day to day. So the village has to be willing to support in the manner in which the person needs the support.
I want to thank Miss Beverly for hopefully enlightening you, and may God bless her story to help anyone out there that she's able to touch. Struggles in life, you never know when it's going to come to your door. We want to embrace each other and help each other as much as we can. Again, this is a day in life at Dr. Allen with Dusk to Dawn Urgent Care, and we thank you guys for watching.